Effective herbal treatment and exercises for sciatica. If you have sciatica, this natural healing video will be of help to you. Ensure you watch it in full for maximum benefit. To skip to the part of this video that applies to you, look in the description box below. What is sciatica? To fully understand sciatica and its effects on the body, one would need to know its roots and where this condition develops from. Sciatica develops from the sciatic nerve. The sciatic nerve, which is regarded as the largest nerve in the entire body, is located at the downside of the body system, connecting from the lower hips through the thighs and feet. This nerve is in charge of sending sensations from the hips down to the foot, thus making it an important part of locomotion amongst other things. Sciatica is the inflammation of the sciatic nerve leading to pain and other unpleasant conditions. It could be as a result of injury, skeletal disorders, and several other conditions. Its symptoms include pain and numbness in the lower region of the body, which includes hips, thighs and legs. To overcome this condition, there are several techniques or methods that can be employed. It could be natural, medicinal, or even the use of herbs, and in severe cases surgery. Sciatica is an unpleasant condition that affects the overall health of the body system and should be given proper attention. Causes of sciatica. Sciatica is caused by the compression and inflammation of the sciatic nerve. Heinated disc. Although sciatica could be as a result of several other health conditions or injuries, its major cause is the displacement of the disc, which acts as a cushion between the spinal nerves and the vertebrae. To further explain this condition, the spinal canal consists of the spinal nerves, main organ, the vertebrae which act as a protector of the nerves, and the discs which acts as cushions between both previously mentioned parts. It is this cushion that prevents the vertebrae and other bony structures from compressing or pressuring the nerves, and when it is displaced it could lead to sciatica. Lumbar spinal stenosis. Lumbar spinal stenosis is one of the conditions that leads to sciatica. This condition is characterized by shrinking of the spinal canal, thus resulting in pressure on the nerves and pain. Lumbar spinal stenosis is often developed as aging occurs due to body changes and degradation, and so it is more common among the elderly. Although, this condition can also be developed at a young age due to injuries, stunted growth, and other factors. Some people are also born with lumbar spinal stenosis. Spinal tumors. One of the major causes of sciatica is the development of tumors in the spine area. It could be located along the canal, at the site of the nerves, or near the bones and discs that surround the nerves. Cauda equina syndrome. Of all the causes of sciatica, this is the most serious and severe, as it could lead to permanent paralysis and damage of the spinal nerves if surgical treatment is not done immediately. The cauda equina syndrome is a condition where there is intense pressuring or compression of the nerves located at the root of the spinal canal. These nerves are responsible for sending information to the lower part of the body, which consists of the thighs, legs, foot and all other parts. Cauda equina syndrome (CES) is usually as a result of fatally displaced or damaged disc, intense shrinking of the spinal canal, or any other severe spinal tumors or injuries. This condition should be treated immediately to avoid permanent damage, and ultimately loss of locomotion. Symptoms of sciatica. Pain in lower body parts. Lower body muscle numbness. Leg weakness. Burning sensation on legs. Sciatica treatment at home. Exercise. Although this may sound counterproductive due to the nature of the condition, exercise is one of the best ways to ease pain from sciatica and prevent aggravation of its symptoms. Gentle exercises which involve stretching help increase the flexibility of the spine and prevent compression. Another factor which makes exercise very helpful in treating sciatica is that these activities stimulate the production of endorphins, thus relieving pain temporarily. Heat and cold compress. The heat and ice treatment technique is one that has been used for relieving pain from sciatica for years, and it has been found to be very effective. The process, which involves alternating the use of ice packs and hot water, helps reduce inflammation and speed up healing simultaneously. To use this technique, ice packs should be put on the area where the pain is being felt. The function of the ice pack is to reduce inflammation. After a while, heat should be applied to the same area, as this boosts blood flow in the area, thus speeding up the rate of healing. It is, however, important to ensure that the skin is protected while using the heat technique to prevent damage. Posture adjustment. Sometimes, sciatica may not be as a result of an underlying health condition but basic issues such as the wrong posture, which leads to excess and partial pressure on some parts, and this includes the lumbar region. The constant rotation of posture helps keep the pressure, particularly that of body weight, from being on a particular area for too long. Also, ensuring proper posture helps to keep the body in shape and prevent other long-term health and body defects that may occur. NSAIDs. NSAIDs is an acronym for non-steroidal anti-inflammatory drugs, and they are federally approved drugs which have been certified to be capable of easing pain and reversing inflammation without posing any serious long-term health consequences, as long as they are used with caution. These drugs can be gotten from local pharmacies or through prescriptions and are very effective in stopping the pain in several parts of the body, and that includes those of the spine. It is, however, important not to rely on the use of these drugs completely, and to employ the use of other treatment methods to avoid problems associated with drug abuse and addiction. Herbal remedies for sciatica. Turmeric. Turmeric is one of the best spice for treating inflammations in several parts of the body, be it internal or external, and is very effective. This spice has a very strong and potent anti-inflammatory properties which helps in relieving pain and other symptoms of sciatica. Turmeric can be used to make herbal teas for consumption or used in preparing meals. It can also be used as a paste to rub on inflamed areas. Garlic. The use of garlic in treating sciatica is similar to that of turmeric, as its main abilities lie in its anti-inflammatory properties. Garlic can be consumed raw, used to make herbal teas, and also used as a spice in meals. Apart from its ability to reduce inflammation, garlic also offers several other health benefits to the body, of which one is detoxification. St. John wort. St. John wort is a highly medicinal plant that is characterized by its yellow and star-shaped appearance. This plant, which is well known for its high antidepressant, anti-inflammatory and antibacterial nature. It can be prepared and consumed in a variety of ways and can be used to treat several disorders and ailment. The oil, which is an extract from this plant, can be used to treat sciatica by applying it to the region which pain is noticed. It helps reduce inflammation there. Jamaican dogwood. This is another medicinal herb that has been used for the treatment of several infections and disorders for centuries. The main ingredient, which is the bark of the dogwood tree, helps reduce inflammation and acts as an antidepressant. This herb is also very effective in reversing the symptoms of sciatica. Sciatica treatment exercises. Spinal stretch. Sciatica is caused by compression of the spinal canal, which consists of the vertebrae, thus leading to excess pressure on nerves. This exercise helps increase the flexibility and opens up the spinal canal to give more space. 1. Take a seat on the ground with your legs clearly spread out and keep your feet perpendicular to the ground. 2. Raise your left knee while keeping your foot flat on the ground, and make sure your leg stays on the outside of the other foot. 3. While keeping your left knee upright and your foot fixed on the floor, place your right elbow on the left knee and rotate in the direction of your left knee. This helps to stretch the lumbar area and the spine. 4. Turn as far as you can, and then hold on for 30 seconds, take a break and repeat this exercise 4 times before switching sides and repeating the whole process again. Sitting pigeon pose exercise. 1. Take a seat on the ground, keeping your waist perpendicular to the ground, your legs completely stretched and your feet facing up. 2. Bend your right leg, while keeping the other parts completely fixed on the ground. After assuming this position, place your right ankle on your left knee. 3. While keeping your buttocks, thighs, and legs completely fixed on the ground, take a lean and try to close the distance between your chest and thighs. Go as close as you can and hold this position for a few seconds. 4. Hold on to this position for 30 seconds. 5. Rest for a few minutes and repeat the exercise on the other side of your body. Horizontal pigeon pose. 1. Take a horizontal position on the ground, with your legs and hands fully stretched. 2. Raise the left knee, keeping a space between the legs and your thighs. 3. Using your hands, reach underneath the thighs and use them to grab one another, softly pulling back on your thighs. 4. Raise the right leg while putting your left ankle on the head of the right knee. 5. Keep to that position for a few seconds. 6. Repeat the process using your other leg. Hamstring stretch. 1. Take a stand with your body fully relaxed, do not keep on any heavy weight or dress. 2. Raise your right leg and place it on a surface higher than your normal foot level. This could be a pack of books, plastic, stairs or any useful tool that will guarantee a higher elevation of the foot. 3. While keeping your right knee elevated, take a lean moving toward your right knee, while making sure your left foot is fixed on the ground and your left leg straight. 4. While still maintaining the leaning position, push your hip forward and backward to stretch it. 5. Maintain the position for a few seconds, and repeat the exercise with the other legs raised and the body parts alternated. Sciatica surgical treatment. Sciatica is often treated naturally, with exercises, meditations, herbal treatment and other alternatives, but in some cases where the condition is very severe, such as spinal stenosis, the use of surgical treatment may be advised. There are two major types of surgical treatment for sciatica. 1. Discectomy. This is a surgical procedure whereby an incision is made, and the heinated or displaced disc is operated on and removed to stop compressions of the sciatic nerve. It can also be referred to as microdiscectomy, but in that case, very tiny incisions are made and the use of magnifications is used. The main purpose of microdiscectomy rather than the regular discectomy procedure is that it allows faster healing. 2. Laminectomy. One of the major structures which protect the spinal nerve and canal from damage or compressions is the lamina. Sometimes, this protective structure can be removed completely or partially to reduce the symptoms of sciatica. A case where the lamina is completely removed is known as laminectomy, but its partial removal is laminotomy. Are you battling sciatica? Have you tried any of the treatment options listed in this video? Please leave your opinion in the comment box below. Don't forget to like this video and click the subscribe button below for more research-based home remedies, natural health and motivational tips. Remember to click the bell icon to be notified when we upload new videos. Follow us on Facebook at Natural Herb Cures and Twitter at Natural Herb Cure, and our official website at naturalhealingguides.com. Thanks for watching.